Good morning, everybody. It's Dr. G. You can call me Sunny, and this is one of the recordings for my Energy for Life community. And this is an anti-aging and holistic healing community. We're going to be talking about pain from vertebral compression fractures, how to help it, also new ways to work with osteoporosis, new ways to get your bones stronger. So this is something that if you don't have issues with vertebral compression fractures or osteoporosis, you probably know somebody that does. So this is really important for everybody to understand. And the first thing that I want to say is prevention is always the best, right? If you can possibly avoid getting vertebral compression fractures, well, that'd be great because then less pain as we get older. It is one of the most plaguing things for many people, especially women, as they get older, when their bones become less strong, and then just the natural weight of the spine and minor trauma can create these little crunches in their back, which can mash on nerves and cause a lot of pain. All right, so how do we prevent? First off, you guys, right now, we want to start to weight our spine vertically. All right. If you have text neck, if you're on your phone or on your computer a lot, we must stand up straight, engage your lower back, have somebody take a picture of you to see how you're standing. Okay. Because that is one thing we don't talk about it too much, but it's important when we weight our spine vertically. It is putting normal pressures on all of, it's basically a column of boxes, and if you're always forward, you're putting more pressure on the front of the boxes, which are your vertebral bodies. And that can, especially when combined with force, lead to, when your bones are thin, lead to fractures. So we want to stand up straight. We want to make sure that we're getting adequate K2, okay, vitamin D, K2. And K2 is something, so if you take vitamin D3, which generally speaking, I suggest for people, it does a lot of great things in the body. You always want to pair it with vitamin K2 or get vitamin K2 from your food. A great place my favorite place to get vitamin K2 is natto, which is fermented soybeans or sticky soybeans, and because it's very rich in nattokinase and vitamin K2. So it's like a double whammy of goodness. We always want to, in terms of calcium, better to eat than take a supplement. We know that like larger calcium supplements, generally speaking, should not be recommended to people because it gives you kind of a vascular bolus of calcium, and can have increased risk of cardiovascular events. So I don't suggest calcium supplements per se. I suggest we try and get it via food. So prevention, standing up straight, keeping your bones strong. How do we keep our bones strong? Well, we've always talked about weight-bearing activity. Yes. So over your life, you can build up a store of bone, right? And the more exercise and activity you do when you're younger, the stronger your bones get. This is especially true during times when you're actively creating sex hormones, because those both testosterone and estrogen contribute to bone strength. So in thinking about this, if you go into early menopause, you really want to have some bioidentical hormone replacement, so that you are not starting to immediately lose bone as though you were as though you were older. And if you wonder whether or not you should be on hormone replacement as a woman, there's an excellent book called Estrogen Matters. 100% of y'all should read that book, Estrogen Matters, because it really looks at the new information on how hormone replacement is not just helpful for hot flashes, but it is for other things. And when started right after menopause, has multiple benefits. Okay, so just saying, talk with your doctor about this. And if your doctor has not read the book Estrogen Matters, they need to read it. You need to go in there and carry it to your doctor and let them read that. So the other thing in terms of prevention is we know that your lifetime dose of steroids, and that means inhaled steroids, orally taken steroids, is linked with more increased risk of osteoporosis, more increased risk of a fracture. So if you are on steroids of some sort, you always want to minimize the dose. Just don't just keep hitting the steroid inhaler if you haven't talked to your doctor about stepping down. And ways that you can reduce your risk of steroid inhalers are making sure the air that you're breathing is really clean, right? No mold in the house, pollution from the highway. We want to make sure the air is filtered, especially in our homes, because indoor air can create a lot of problems if it's not nice and clean, right? So then we're reducing our risk of steroid inhalers as much as possible to make sure that you can breathe and that you're not increasing your risk of osteoporosis. But now let's talk about what happens if, so you get osteoporosis. How can you manage this? Well, there's medications. And now there are other things that you can do to manage osteoporosis. I want to highlight a recent study that I came across after I had a really interesting conversation with the guy that came up with OsteoStrong. If you haven't heard of OsteoStrong, it's a franchise that helps people with bone density. And he was what a guy. He was talking about how what happens is in order to really stimulate bone density, we need to put forth a lot of effort on those bones to stimulate the growth. And he showed that in these OsteoStrong treatments, 10-minute treatments of low impact, high intensity, osteogenic loading. Now, what exactly does that mean? It showed with these 10-minute treatments over a year improves bone mineral density. I mean, he really showed that. And it was not, everybody had DEXAs, markers of bone density markers. And these p-values are incredible, right? P.0001, that means it's highly statistically significant and due to the intervention. So this was done in Greece. But basically, when I talked with him on the interview, he's like, people think we can just do a little bit of weightlifting, but what he does, it is a machine that measures what's your push, and it's not a static push, but it can sense how much you're pushing, and that way it can give you feedback on how much you're pushing. In my mind, I believe that this could probably be accomplished at home without having to go to OsteoStrong, although it's easier just to go to OsteoStrong, but they're not everywhere, right? Pushing with great force using isometrics, okay? So how do I do this at home? This is going to look funny when you think about it. I get in a door frame, okay? I'm in a door frame. I'm standing on a platform. I actually stand on a vibration platform because a vibration platform has been shown to improve bone mineral density. With a vibrational platform, you really want it to not have this kind of motion. It needs to have up and down, so single motor, up and down motion. So it's not doing this. And so I stand in the door frame and I get above me, I put my hands on the top of the door frame and I stand up very straight and I push to load my spine. I push out on the door frame so that I'm using a lot of intensity. I also hold my arms up and then bend my knees and then push up, making sure I'm weighting myself with my legs to try and mimic that high intensity, very short. I do it for 8 to 10 seconds. And this is similar, maybe not perfectly reproduced, but this is how you can do the economical version of OsteoStrong. I know they use vibration plates there and they use these static. They also have a leg press. And so with the leg press, there's ways. A static leg press can be done by pushing on, like getting in between. So this is going to also sound funny, but getting in your bathroom and putting your back against the tub and then pushing against cabinets. So pushing against cabinets so that you're getting a significant or something. So you're getting a significant amount of pressure, and it's not just light bouncing. Because I don't think that we know that people who just do just do jogging, especially guys, if you're doing jogging like this, that is not going to be great in terms of compression fractures. If you already have like a little bit of a hump, you want to try and start to train the position of the spine and do. I don't think that jogging and bouncing, when you have this is just my opinion, have that hump already, is going to be helpful. And so this OsteoStrong has been shown to help. Now, what other things, new things, when we look at the different types of interventions that are available, conservative management, giving people pain medicine, non-steroidal anti-inflammatories, or even opioids for short-term severe pain, is sort of how traditionally it's been done, like rest, don't do that, right? Giving these kind of instructions. Don't lift heavy things, and then physical therapy to strengthen your back muscles, and then balance posture training. These are conservative management. And then people can take bisphosphonates. Bisphosphonates come with extra issues, right? They have side effects. You can't even take them for very long because of the side effects. So it's important we find other ways to get your bones strong. So prevention is one, treatment. Let's talk about the other ways. One way is something called biophysical stimulation, right? Y'all who know me know energy medicine, it's the medicine of the future. Current pulse electromagnetic field is going to be the way that we treat people in the future. Light. And so this is, let me share my screen real quick. Am I sharing it? I'll show you a picture. All right, so this is an article. Am I sharing it yet? Nope. Share screen. Okay, there we go. All right. So this is an article that is called Biophysical Stimulation and multimodal management of vertebral compression fractures. So this is not something that your physician has recommended. This is like non-drug, clearly shown to be beneficial, and it's you need to talk to them about it. Okay, I'm going to scroll down. This is what a compression fracture looks like, guys. You see here in the middle where the boxes look pretty normal going down, and then you see this one that is lopsided. It's squished. It's got arrows pointing at it. Okay, so that's what it looks like on an X-ray. And then when we go down here, this is somebody hooked up to, it looks like a TENS. It's not a TENS. They can actually, this is a way that they have treated like non-healing fractures, because we know current stimulated across the gap can improve healing. They first recognized this in horses, right? And so there are different ways to apply a current, right? Microcurrent can be applied with pads. You can also get a pad that puts out a pulsed electromagnetic field, but these are adjuncts to therapy that have been shown to improve outcomes, to improve healing of the wounds. And we understand at least some of the mechanisms here, right? So, there's both. Well, there's several different ways that we know pulsed electromagnetic fields can affect calcium channels in the cells that help your bone to start to heal, basically. I mean, and so current is one of those things that if you have osteoporosis or you have vertebral compression fractures, this is really important to understand. And moving forward, of course, everybody's heard about surgery. There's a couple different types of surgery, right? A vertebroplasty is when basically they go and they inject bone cement into the fractured vertebra to kind of pump it up. Kyphoplasty, on the other hand, is similar, but what it does is it makes a space, it sticks a little balloon in there, and then puts the cement in, so it pumps it up, right? These are surgical methods, and they can be done through the skin. Isn't that interesting? So using specialized imaging, you can do this through the skin, And not there, a recent study was looking at doing it through the skin for people who aren't typically your surgical candidates, okay? So there may be more options if you have to. Gosh, guys, if you can avoid surgery, wouldn't that be great? And so we know that surgery can cause problems. The more times that you go under general anesthesia, the more risk you have of brain problems, cognitive problems later. So we really want to limit that if at all possible. So let's talk about stem cells. I love this topic because this is going to be what's happening. Regenerative medicine is coming. We'll be growing our own stem cells, put them in a petri dish with the right Yamanaka factors. And as I talked about yesterday, B12 is going to be there because we know that stimulates B12. Adequate B12 can help stimulate the growth of your stem cells. And so people are starting to do procedures like injecting stem cells to see if we can get the bone to start to regenerate. And there are other ways, photobiomodulation. You guys who've listened to me at all know I talk about photobiomodulation, phototherapy patches that can help in this way. They can stimulate the production of certain proteins that will stimulate the universal cells. And it can be a way that the turns on the body's healing from the inside out. And within our community, the Energy for Life community, if you're listening to this, you're wondering, well, how can I get more videos like this? I mean, this is part of my pain course that has videos on, how you can reduce pain. And as we are talking about reducing pain right now, it's important you realize that much of our pain, it's about a signal coming from our brain. So we must treat the brain too, in order to minimize the pain as much as possible. It's not just about living with the pain, but when you use something like the Curable app, shout out to the Curable app, love you guys. If you have chronic pain, it can be extremely helpful with all kinds of pain, vertebral compression fractures, back pain, whatever kind of pain you have. So understanding that these new ways of healing are going to be coming into common usage, and knowing that we all need to work together, conventional physicians, integrative, holistic, functional medicine. We all need to use all the tools to find what's best for you. And that's where I think that that I have a unique perspective being part of both of those worlds. So if you want to find more about how to be part of the Energy for Life community, where you can access lots of free videos, you can reach out to me, send me an email, clinic@feelgoodfunctionalmed.com. That email is below in the description. And I would love to hear from you. And if you're a practitioner and you think, gosh, I'd like to incorporate a little bit of functional medicine into my practice, I'm not sure how, reach out to me, because that's something also that I can help you with, trying to give you a few tools to make it simple for you to just add some basic things that could help your clients so much. So I've got a lot of free resources for all of you guys, from my heart to yours. And I'm here to try and make you be able to have the best life, best health, like total wellness, joy. Today, I hope that you find joy, you find peace in the present moment. And I'm rooting for all you guys. All right, so I'll see you tomorrow around the same time. Oh wait, no, I'm going on vacation. So tomorrow I'm not going to be live because unless we're running behind. So I might be live, but I'm gonna go skiing in Whistler. I'm so excited. Oh my gosh. I'm gonna have a fun time with my family. So I hope you guys are looking forward to time with your family this season, and that you're able to enjoy each moment. All right, guys, see you later. Bye.